Breast Cancer Awareness Month is coming up in October, and that's a good reminder to have these important conversations about your health. Dr. Lori from HCA Midwest Health joins us here to talk through some of the common myths associated with breast cancer. So one of the most common ones women hear is that deodorant, of all things, can actually cause cancer.
Right. This myth has been around for a very long time, primarily related to concerns about the aluminum, which is present in a lot of deodorants and antiperspirants, particularly deodorants, however, and there's no scientific evidence to support any relationship between aluminum exposure in deodorants and increased risk for breast cancer.
So that's a good news. So you can
right.
keep on wearing deodorant and you won't be at risk or susceptible whatsoever.
There's absolutely no evidence to support that myth.
Okay,
That's why it's a myth.
That's why it's a myth. What about this one? Wearing an underwire bra. I hadn't heard of this, but a few of my friends had.
Yes. So another myth that's been around for a very long period of time, there's no scientific evidence whatsoever that supports the idea that wearing a bra with an underwire, or any other bra for that matter, will increase your risk for breast cancer. In fact, wearing a bra oftentimes helps women have greater support and less back pain and less discomfort with running and exercising and things like that. So there's absolutely no reason not to wear a bra unless it happens to be personal preference, but it does not increase your risk for breast cancer whatsoever.
Okay, so you can wear whatever you want just to keep you feeling secure. We also want to know, what about carrying a cell phone in your bra when you're running?
There is, again, no evidence to support that exposure to cell phone or cell phone usage is related in any way to breast cancer. There is no increased risk for exposure to the energy levels that are emitted from a cell phone. This has been disproven scientifically.
Okay, so our first three ones have all been false. What about risk for women under 40? Is it still possible, and how much of a risk is it that you could get breast cancer?
Well, unfortunately, young women, even in their 20s, and even in some cases earlier than that, have been documented to have breast cancer. So you can get breast cancer when you are younger than 40, and this requires sitting down with your family medicine or internal medicine physician, your OBGYN, and discussing what your personal risk factors are. And so in those who have greater risk factors, maybe recommendations for earlier screening and maybe advisement on what to look for, perhaps breast discomfort, nipple discharge, things like that. But women under 40 can get breast cancer, unfortunately.
Okay. How do we know if we do have breast cancer? Is there always going to be a lump?
There is not always going to be a lump. There are certain types of breast cancer that can cause inflammatory changes, maybe puckering of the nipple, nipple discharge, itchiness, pruritus, just redness, inflammation. If there's any of that and no lump, you still need to go see a physician to have that looked at.
So it's kind of like if you feel like something's wrong and you're noticing some symptoms, get it checked out anyway.
Absolutely.
Okay. This last one, breast cancer is scary, but it's no longer a death sentence.
It is absolutely not a death sentence. Scientists have made great leaps in our understanding of breast cancer. Clinicians have made great leaps in treating and managing breast cancer, so it is not a death sentence.
And that's great news. Thank you so much, Dr. Lori. Now, of course, we do want to tell you that you can take a free online breast risk assessment at hcamidwest.com/breast. There you can also read about the latest advancements.